Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, today we are going to talk about you screwed that one up. We're going to talk about the reverse total shoulder arthroplasty.
Okay.
This is a new surgery. Well, it's actually not new, is it?
No, actually, and I'm going to back up one step because a lot of people out there that are 40 and older and be watching this they may be getting this, but typically if you're 70 years and older get this particular procedure. And arthroplasty just means replacement. So it's one of those big terms that if you get a knee replacement, that's really an arthroplasty as well. So we're going to talk about a shoulder arthroplasty or replacement. And oftentimes the shoulder replacement is done as, if you look at the shoulder here, this is a model of the shoulder right here.
Yeah, right shoulder.
And this muscles here, you can see this. Are you zoomed in on that? This is the collarbone, so let's put this up here. Now this is for a smaller person than Bob. Here's the collarbone, and this actually is the scapula or the shoulder blade back here.
Yeah.
So if I were to pull that off of there from Bob, put his arm back on, that didn't hurt, did it, Bob?
No.
Have a seat. All right. So the shoulder joint, when you do this, flexion and abduction, two major motions, and this is how that looks. Now, if we pop that out like that, you can see the bone here, the humerus, has a ball on it.
Yeah, let's make sure you can see that.
There you go. Now, that ball fits in a really shallow socket called, there we go, the glenoid. Fossa, they call that. Not that you need to know that. Now, when you get a...
Like Mufasa.
Mufasa. Okay. Like fossa. Let's get back into it, Bob.
So it's normally a ball in a socket.
Right. Okay, so normally on a normal shoulder replacement, they replace this ball with a ball that looks like this right there. Cut that off, put a steel ball in there, and it goes down into the bone there, and then they replace this
socket
with a socket just like this. I mean, it's close.
Right.
Obviously, it's not exactly the same, but it's functional, and it goes back in there, and they sew you up, and you go through about 3 months of rehab, and you have a functional shoulder that works fairly good, and you get pretty good recovery with these with fairly normal range of motion out to the front and to the side. Now, if you're 70 and older and you have severe arthritis, which is a primary cause for having this procedure done, and if the person cannot tolerate this type of procedure. This is all done by the surgeon. Bob and I, we discussed it. We're not surgeons, and we're not going to come up with which one procedure you're going to have. We're just using statistics from the studies. But this is called a reverse shoulder replacement. And it's kind of neat. Actually, they replace this ball, and that becomes the socket. So the socket is actually on where the ball was, and then they put a ball in here where the socket was. So
we have a picture here, Brad, that kind of shows that.
Yeah, that's something you can zoom in on, Nancy.
This is the old way, right?
Yeah, this is the old way.
So here was the ball,
right?
You don't have your pointer?
No, but we do have a humerus. Right here, this represents the ball, and here's the prosthesis of the metal portion that goes down into the bone. That would go down into here, and here's the ball, and there's the artificial ball and the artificial socket. This would be somewhat like an x-ray, but it's just drawn up. Now, if you look at the reverse one, can you zoom in on that, Nancy? You got a pretty good focused-in view. They show the ball is attached. Here's the person's shoulder right here, the scapula. There's the ball. You can see two screws right there holding that in. And then the socket is actually put into the arm or the humerus right there. So it's completely reversed. And that's the mechanics of it right there.
You have some statistics on this, right?
You better believe it. So this has been going on for 20 years in Europe. Europe usually starts things in general in the medical field before we do. And about 7 to 8 years it's been common in the United States. And there was a study done with about 70 patients, and they came up with 68%, this is the United States, 68% of them had good to excellent results. There were 17% that were not happy with them. You know, it's a newer procedure, that's not too bad. I've worked with a total shoulder replacement or a reverse one, as a matter of fact, just this year, and she had good results.
Well, I'm going to tell you, this is just anecdotally too, because I probably have had 5 or 6 of them.
Okay.
And they started showing up around 2 or 3 years ago, and this was a Mayo Clinic was doing these.
Sure.
And I've had I will say again, I think I've had better results with these patients than I did with a regular total shoulder.
Oh, really?
Yep, absolutely.
And
better range, quicker. Better motion, quicker.
Okay.
That's again, that's only talking about 5 people, but and the lady now that we have is better. She was really a tore up shoulder, and she's getting very good results based on this reverse total shoulder.
Excellent.
So.
And were they 70 or older?
Yes,
okay.
They were absolutely of that age.
Arthritic,
and sometimes beyond that.
Sure.
Sometimes damage from an accident even too.
And what the studies are saying is, actually, they're saying normally you don't get as good, and they're saying if you get to 90 degrees this way, about this far, that's about as good as you're going to get. But if you're finding better results,
these were better than that.
Bob's a good therapist, so.
Well, a lot of them, and to be honest, in the past, the total shoulder arthroplasty, I didn't have great results with a lot of my patients.
Right.
They ended up being very poor, to be
Sure.
honest with you. So that's why I was happy to see this and how it's been so far. So personally, I wouldn't hesitate at all to have one done. At a well-known, reputable.
Right. Yeah, you don't go asking for a shoulder replacement surgery because the rehab's pretty lengthy. I mean, with yours, the one I had.
They are lengthy.
The first month was not very pleasant for her. I think she had some more unusual circumstances. But the ones you've done. 3 months?
Yeah, at least 3 months.
Yeah.
I mean, it's lengthy. It's not. This is not a quick, not like a hip replacement, which is really pretty quick.
Right.
Knee replacement is a little bit longer, but this is the longest of the 3. Once you say for
it's a more complicated joint.
Yeah.
There's a good reason for it.
Yep.
So if you're interested in doing this, talk to your surgeon about it, and that's where you're going to get the best information. But this gives you an overall picture. If your shoulders are very arthritic, you're over 70, and typically these people move about this much before surgery.
Exactly.
So if you only get to here, you're functional.
Yeah, this is functional.
You can at least reach into the cupboard. So again, if you're 40 and over, I think this is a video place that you're going to get.
Or you want to mention it to your parents who might be of that age and that they may need.
Right. Yeah, because if your parents are 70 years old, they may not want to watch the video, but you might, and they can help them out as well. Subscribe. Take care.
Bye.